Hi Felicia, how are you today?
I'm well, thank you very much. Thank you for having me.
Today we are interviewing you for a psychiatric mental health nurse practitioner position hit at our outpatient mental health clinic, okay?
Yes, ma'am.
Okay, we're gonna start. Why you don't tell me a little bit about yourself and your background?
Thank you very much once again. I'm a nurse with experience in medical, surgical, and also psychiatric nursing. I recently completed my Master's of Science in Nursing as a Psych Mental Health NP at Regis College in Massachusetts. During my clinical rotations, I worked with outpatient and inpatient psychiatric facilities. This helped strengthen my assessment skills and helped me develop holistic care plans. I'm passionate about the care I provide for my patients, and I ensure that my care is patient-centered. And I also enjoy helping individuals manage their mental health conditions while promoting overall wellness.
Wow, you have a very impressive background.
Thank you very much.
How was your registered nurse experience prepare you for this MP role?
Well, my nursing experience has taught me strong clinical assessment skills. I have great communication skills, critical thinking skills. Working in psychiatric units have allowed me to practice therapeutic communication, de-escalation techniques, and also crisis intervention. I've also collaborated with many teams, interdisciplinary teams, which has prepared me for the role of coordination as an NP.
Wow, it's impressive. Tell me a little bit about a challenge that you recently experienced or in the past in your job. Tell me about a situation that you have in your job and how you handle it.
During clinical rotation, I had a patient experience where the patient was experiencing severe depression and treatment resistance. What I did was I focused on active listening, validating their feelings, and also discussed their treatment with the patient and also a team. What I did was involve the attending psychiatrist and also a social worker. We were able to come together and develop a plan which combined therapy and also gradually adjusting the patient's medication. At the end of the day, there was improvement, there was patient engagement, and there was also adherence.
Wow, I'm glad the patient can improve. How do you, talking about that patient, how do you assess and manage suicide risk?
So suicide is very important to me. My experience, especially with the VA, exposed me to suicide assessment because we did it every day. I conduct a thorough risk assessment. I explore intent, plan, means, and also any protective factors. When it comes to suicide, it is important for me to involve a treatment team to create a safety plan, which involves support systems and also arrange close follow-up. Timely documentation is important. Supervising with providers is also essential. When it comes to suicide, my priority is safety, patient safety, and also maintaining trust.
Yeah, of course, I understand. And I know in this position it's going to be challenging. You have to take very hard decisions. So, how do you collaborate with other healthcare professionals?
I actively communicate with other healthcare professionals, with therapists, with social workers, primary providers, and also even pharmacy to be able to coordinate care for a patient. For example, if a patient experiences side effects from an antipsychotic, I will consult with the primary care provider and any team to help manage such risks while ensuring continuity in the psychiatric treatment.
Okay. Honestly, like it's a lot of MP track that you can follow. So why you follow psychiatric specialty?
I'm very passionate about psychiatric and mental health. Prior to working with the VA, I would run away from psych, but my exposure at the VA taught me I was able to see what they're going through, what they've gone through, and what they live with. And my goal is to improve access to mental health care and support my patients through both acute and long-term management of the disease. Um, your clinic's emphasis on integrated patient-centered care aligns with my goals, and I'm excited to contribute my skills and also grow. as an NP in this environment.
Okay. Thank you for choose this path because it's a lot of shortage of providers and a lot of patients are in need. So thank you. Um,
Yeah.
Also for share all this information. Do you have any question for us?
Yes, what does orientation look like? What's the process for new NPs like me? And how are the patient schedules structured for the first few weeks?
Okay. The orientation normally is going to last between 4 and 6 weeks. You're always going to have a mentor with you. New providers or MPs regularly with few patients until they start feeling comfortable and confidence enough to complete the full assignment. Always with a mentor, and you're gonna have a big support to you to ask questions and if you need anything. This support is going to be provided for you until during the transition.
Okay. Okay. Thank you very much, ma'am.
Okay. Thank you for your time today. We appreciate your interest in this position. We're going to be in touch with you for the next step and the hiring process, okay?
Okay. Thank you
Thank
very much for the opportunity. I appreciate your time. Thank
Have a
you.
nice day.
Thank you. Okay, we're going to switch. Hi, Denise. Thank you very much for joining us today. We are interviewing for a family nurse practitioner position at our primary care clinic in Jamaica Plain, Boston. Can
Hi, thank you. Thank you for
welcome
having me today.
us.
It's a pleasure for me. I'm a registered nurse in Mexico, and
Mhm.
I'm also a registered nurse here with several years of experience in nephrology and dialysis nursing. I I currently finished my master in science nurse with the track of family nurse practitioner. My experience caring for patients with chronic illness gives me a lot of interest in primary care and prevention. That's why I I like to work as a family nurse practitioner.
Oh, wonderful, wonderful. You have a very diverse background, I can see. Can you tell me why you chose the family nurse practitioner track?
Sure. I become a family nurse practitioner mainly because I want to expand my role in inpatient care. I want to treat patients. I want to be able to assess them, educate them, and manage their conditions across the lifespan. During my nursing career, I realized how important it is to prevent and educate patients because when patients feels like have a guidance, they can do better. Becoming an FMP is going to allow me to provide this comprehensive care for patients, and I'm still going to maintain the holistic nursing perspective. And the most important thing is like I'm going to be able to build those long relationship with them.
Awesome, awesome, awesome. What experience has best prepared you for this role, in your opinion?
Well, in Mexico, I have a very diverse experience, but talking to here in America, working as a nephrology nurse give me a lot of significantly experience for this role. I care for patients that have a lot of complex chronic condition, such as kidney disease, diabetes, hypertension, cardiac issues. And I frequently provide patient education about medication, diet, lifestyle change. This experience helped me to develop my assessment skills, critical thinking, and the ability to collaborate with other coworkers and different multidisciplinary teams.
Great, great. Can you please tell me about a challenging patient or situation and how you handled it?
Okay. Um, Let me think. Yeah. Recently, we have a patient that he was having a lot of absence from his dialysis treatment, and then the doctor just told me like, just find what is going on. So after it's not only what find it what is going on, so I try to really sit with him and listen to him, and by the chat I found that he was having a lot of family issues, and then his transportation was not he doesn't have any support for transportation, so he has to be begging people to bring him to his dialysis treatment, and that's why it was the main reason he was having issues. So after I was after I was trying to set up times and talking to the social worker and the doctors to adjust the treatment for him, he was able to be more compliant, and also he was more receptive to our to or educational advices to him, and after that he have a big improvement in his health status.
Wonderful. It's a good thing that you're able to work with the social worker and the doctor, because my next question is to ask you how you handle collaboration with other healthcare professionals and physicians. So it looks like you've partly answered that, but please, can you just expand on how you handle this kind of collaboration?
Sure. I strongly value teamwork in healthcare. I think it's very important. I can communicate clearly with physician, nurses, and another type of providers to ensure we're coordinating a good care for our patients. I am comfortable asking them questions, sharing clinical observation, and participating in collaborative decision making to achieve better outcomes for our patients.
Awesome, good. Where do you see yourself in the next 5 years as a nurse practitioner?
I see myself as a confident, skilled nurse, family nurse practitioner, providing care in primary care mainly. I hope I can work for state programs, and I'm going to be able to have CNA certification to help women and apply all this knowledge in my primary care clinic.
Awesome. That's a great goal. Thank you very much for all your answers. Do you have any question for me?
Yes. How many patients does a nurse practitioner typically see per day?
So in our clinic, nurse practitioners typically see about 15 to 20 patients, depending on the complexity of the visit. For new patients, new appointments, and annual physicals, it might take a little bit longer. But for follow-up visits, they're usually short. We make sure that patient schedules are also adjusted based on the experience of the provider and also the clinic workflow. So for a new NP like you, it won't be a great load for you.
Okay.
Answer your question?
Yes, thank you.
Thank you very much for your time today, Denise. We appreciate your participation. Our HR will reach out to you with any follow-up steps for the hiring process if we pick you. We appreciate your interest in our clinic, and I wish you all the best.
Thank you so much. Thank you for the opportunity. I appreciate your time and consideration. Have a nice day.
Have
Thank
a
you.
great day, and bye.
Bye.